Have you ever heard of the term catheterization and wondered what it actually means? Well, wonder no more. Catheterization is a medical procedure that involves inserting a thin, flexible tube called a catheter into the body. This might sound a little intimidating, but it's a very common and generally safe procedure. Catheters can be placed in different parts of the body depending on the medical reason. One of the most common types is urinary catheterization. This is where a catheter is inserted into the bladder to drain urine. Don't worry, we'll delve deeper into the different types of catheters and their uses later on. But first, let's understand why someone might need catheterization in the first place. There are many reasons why a doctor might recommend catheterization. A common reason is urinary retention. This is when someone has difficulty emptying their bladder completely. Urinary retention can occur due to various factors like an enlarged prostate, surgery, certain medications, or nerve damage. Catheterization helps to relieve the discomfort and potential complications of urinary retention. Another reason for catheterization is to monitor urine output accurately. This is particularly important in critically ill patients or those undergoing major surgery. By measuring the amount of urine produced, doctors can assess kidney function and fluid balance. Now, let's talk about the different types of catheters and how they work. The most common type is the indwelling urinary catheter, also known as a Foley catheter. This type of catheter has a small balloon at the tip that is inflated once it's inside the bladder to keep it securely in place. The catheter is then connected to a drainage bag that collects the urine. Another type is the intermittent catheter, which is inserted into the bladder to drain urine and then removed immediately. This type is often used by people who can empty their bladder on their own, but need some help due to certain conditions. There are also catheters used for other purposes, like draining fluids from wounds or delivering medication directly into the bloodstream. Before undergoing catheterization, your healthcare provider will explain the procedure and address any concerns you may have. They will also ask about any allergies you have, especially to latex. After the procedure, it is important to maintain good hygiene to prevent infection. This includes cleaning the area around the catheter with soap and water regularly. While catheterization is generally safe, there are some potential complications, such as urinary tract infections or blockage of the catheter. Contact your doctor immediately if you experience any pain, discomfort, bleeding, or fever. Remember, this information is for educational purposes only, and it's crucial to consult with a qualified healthcare professional for any medical advice, diagnosis, or treatment.